day everyone, I am Princess May Camerino Pudi and I am going to continue the discussion about the family planning and what is the long-acting reversible contraception, or LARC. So the LARC is the most effective method on birth control. LARC has two types of contraception. We have the intrauterine device or the IUD, and the second is the implant. So let's focus first on what is the intrauterine device. So intrauterine device or the IUD lasts for 5 to 10 years. It is a small contraceptive device that are inserted in the uterus or the womb of the lady or the woman to prevent pregnancy. So in IUD, we have two types available: the copper IUD and the hormonal IUD. Both are among the most effective method in contraception and can stay in the place for 5 to 10 years depending on the type. So let's define what is the copper IUD. Copper IUD is the T-shaped plastic and it is made up of copper, while the hormonal IUD is the T-shaped plastic device, so sold as Mirena in Australia. So, however, IUD can prevent the risk of STI or the sexual transmitted infection. One of the best contraception must be used to have a barrier from STI is the condom. The intrauterine device or the IUD inserted in the uterus according to the individual protocols, with the threads cut and the length to allow the patient to check the device position. So much for the IUD. So let's proceed to the implant that lasts for 5 years. So implant and IUDs are alike in other ways too. A doctor or nurse has to insert and remove them. Note that implant can be is not advisable to remove by yourself. So both are reversible, so you can get pregnant as soon as the implant is removed. Contraceptives implant is inserted beneath the skin of the upper arm. It is located here. The implant releases a progestational hormone to prevent the sperm from reaching the egg. So we have the disadvantage of using IUD. We have first, your period may become heavier, longer, or more painful, though this may improve after few months of uses. If you get an infection when you have an IUD is not fitted for you, it could lead to a pelvic infection if not treated. And the third is, most people who stop using IUD is because of vaginal bleeding, pain, although these are side effects of uncommon. So we have also the advantages of using IUD. It protects against the pregnancy for 5 to 10 years depending on the type of IUD. Also, there are no hormonal side effects such as acne, headache, or breast tenderness. Third is, it does not interrupt sex. Fourth is, there's no evidence that IUD will affect your weight or increase the risk of cervical cancer, womb, or cancer on ovarian. And the fifth is, it's not affected by their other medicines. So you can take like vitamins or other medicines. So IUD is not affected by that. So we're done discussing the two types of IUD. So let's proceed to the hormonal contraceptives. So hormonal contraception refers to the birth control method that act on the endocrine system. Almost method are composed of steroid hormones. We have types of hormonal contraception. We have the birth control pill, the vaginal ring, contraceptive skin patch, and we have the depot or the Provera injection. So let's discuss first the birth control pill. So it is a daily pill that contains of hormones to change the way the body works and to prevent pregnancy. Hormones are the chemical substances that control the functioning of the body organ. So, most of the birth control pills are combination of pills containing of a mix of the hormones and estrogen and progesterone to prevent ovulation. So let's proceed to the vaginal ring. The vaginal ring is a small and soft plastic ring that you can place inside your vagina. It releases and continuous dose of hormones, estrogen and progesterone into the bloodstream to prevent pregnancy. If you use it correctly, the vaginal ring is more than 99% effective. So let's proceed to the contraceptive skin patch. So this is new for me. So the birth control patch is thin. It is a square patch that sticks to the skin. It releases hormones through the skin into the bloodstream to prevent pregnancy. Hormones and chemical substances that control the functioning of the body organs. So let's proceed to the Depo or Provera injection. So Depo-Provera is well known as a brand name of medroxyprogesterone acetate, a contraceptive injection that contains the hormone progestin. Depo-Provera is given as the injection every 3 months. So, where did the Depo injected? So, it is located or injected into the arms or buttocks. So, what are the barrier method? So we're done with the two types of IUD, the hormonal contraception. So, let's proceed to the barrier method. So, what is barrier method? The barrier method is a method to stop the sperm from entering the vagina. This stops the sperms from reaching an egg. Barrier methods works better when you use them as a spermicide. So, in barrier, we have two types. We have condom and the internal condom. So, let's discuss first what is condom. So, I assume that everyone knew what is condom. So, let's dig deeper. So, condom is rolled into the penis for sexual intercourse. It is a barrier to stop the sperm and infection passing between sexual partners. It is usually made of rubber. So, why use condoms? So, condoms is a big help to protect against from pregnancy and sexual transmitted infection or the STIs, including HIV, which can lead into AIDS. So, partners share responsibility for safer sex and contraception. So, how safe are condoms? So, if you use correctly every time you have sexual intercourse, condoms provide a very good protection from pregnancy and infection. So, some questions related for this is, why do condoms slip or break? So, these are the reason why it happens. So, we have this reason. Number one is not put in correctly. That it is turned by fingernails, jewelry, or teeth. Not enough lubricants or wetness during the sexual intercourse. The wrong lubricant is used. Prolonged or a very vigorous sexual intercourse. Penis the soft before withdrawal. Condom slips off during withdrawal, or the rubber loses its strength when condoms are kept on the warm place like glove box or hip pocket. So, the rubber loses its strength because the condoms has expired, and the rubber is damaged by some trash or treatments like chlorotrimazole or So, the last is the internal condom. It is a tube with flexible ring at each end. So, one end is closed and the other end is open. So the internal condom is inserted deep into the vagina just before vaginal intercourse. The ring at the closed ends hold the pouch in the vagina, and the ring at open stay outside at the vaginal opening during the intercourse. So how do internal condoms work? So internal condoms work, it covers the inside of vagina and collect pre-cum and semen during the ejaculation. This keeps the sperm from entering the vagina. So what are they made of? So the internal condom is made of nitrile polymer, that's the same material that medical gloves are made from. So that's all for my report. If you have a further question, just raise it during the discussion. So thank you so much. I am Princess May Pudi, and I hope you learned something from what are the long-active reversible contraception, what are the hormonal contraception, and most importantly is what are the effective barriers method. So again, thank you so much and have a good day.